Chris, do you want to give me like a nod or something when you think we're good on YouTube?
We are streaming on YouTube.
Okay. All right. Good afternoon / evening, I suppose. Thanks for joining us for another DCSD Town Hall. We're going to kick off here in about 2 more minutes. We're just giving everyone a chance to settle in and grab some water and some chips or Pop-Tarts or whatever your after work or school food it happens to be. We'll get started here in about 2 minutes. I'll unmute myself first. That'll probably help. We're going to go ahead and get started. Good evening, families and community members of Douglas County, and thank you for joining us for another DCSD Town Hall meeting. My name is Nate Jones. I'm the Communications Manager for the school district, and I'll be serving as the moderator for today's discussion. We're scheduled for 1 hour. I'd like to thank our community members that have submitted questions over the last week. We're going to try and get to as many of the common questions as we can today, but please look forward to more answers from today, as well as answers to other questions we've received as we continue to update our FAQ on our website. Joining me for this town hall today is our Douglas County School District Interim Superintendent, Corey Wise. Mr. Wise, thank you once again for your time this evening. I know it's not always easy to give up, especially when you've got kids in athletics, so thank you. We've also got several members of the DCSD Superintendent's Cabinet with us this afternoon, and I would like to thank them for their time and their expertise, as we'll likely be hearing from a couple of them this evening. After some opening remarks, we'll get to some of our questions as part of our FAQ, or I suppose our question and answer section. But before we get to that, I do want to acknowledge our board of directors. So thank you to Directors David Ray, Krista Holtzman, Kevin Lung, Anthony Graziano, Christina Chancho-Shore, Elizabeth Hansen, and Susan Meek. Thank you so much for your continued support. We're going to go ahead and get started with some opening remarks from Interim Superintendent Corey Wise.
Thanks, Nate. Nate, Christian, all of communications, cabinet members that are here, appreciate you being a part of this and all your work to get this going. To the community, parents, everyone, thanks for taking some time. Thanks for asking questions and being a part of this tonight. First off, I just want to talk about each level. The elementary schools, getting back out into schools has been awesome. To see the number of classes going on and the kids, it's been great to just watch the energy and the learning. Want to say thank you to all the teachers and staff. The commitment level to be back in person since January, and just seeing the results, so proud. Middle school and high school, returning to in-person hybrid 2.0. Jumping into some middle schools and high schools this week. I want you to know it's, nothing's easy. It's do a lot of work. And what I saw out there that I'm so proud of, I saw a middle school English class where you had kids working in groups on the outsiders. You had kids at home that were presenting and also kids in class presenting together. I saw a 7th grade science class, and the teacher said, coming back, I was nervous. I didn't think I could do this well. I wasn't sure how I would do it. It's going better than I thought. She had an earbud in. She had her kids in her science class working in groups. She had kids on the computer up front. As kids on the computer that were working at a question, she could hear them, work with all of them and go through. I saw a Spanish 3 class where kids were up on a big screen and the other kids working in class and working back together. AP chemistry, AP Econ. It's not perfect, but everybody's working hard. The effort, both of the students and kids, students and teachers, I can't say enough. And I'll tell you, I was asking students, are you happy to be back? And give me a thumbs up, medium, or down. And majority were like this, a few were like this, and some were like this. And I asked why. It was funny to hear some of the answers. Some were like, it's day 2 of back hybrid. I'm tired. It was easy to get up 5 or 10 minutes before class, and now you have to get ready and get here. So we'll work through it. And others that, said, I worried about coming back, and I appreciated it and said, hey, you know what? It's funny to think of perspectives and answers, and appreciate all the work you're doing. That change is hard. Find the positive and go through. So I just want you to know, I'm proud of the work. It's not going to be perfect. There's a lot of wants. There's a lot of needs. But I would tell you, I can't be more proud of the effort, and it's only going to get better. And how we work through, if there's problems out there, reach out. There's bumps in the road, but everyone's going to work together. You might not get everything, but I think people are going to work to find solutions and hopefully create understanding. And that's important in this process. So I appreciate, as parents, all the work you've done this year. It's hard. As a parent myself, it's not perfect. It's difficult how we work through challenges, how we celebrate and find the positive. But I appreciate your flexibility. I appreciate your patience. I appreciate your loyalty and commitment. I was at Summit View, and as I was walking to Summit View, a parent who was leaving the parking lot actually stopped their car, got out, and just came over and said, thank you. Thanks to all the work that's going on. That, it means a lot. We try to listen to everything. We listen to the critical pieces. We also listen to the positive, and we listen to the ideas. And I know that's not always seen, but it's valued, it's important, and we try to do that. So with that, Nate, that's breaking. I don't want to take all the time, but I just want to say we're excited. I will say vaccinations are a big part of this, and we've able to amp up the number of vaccinations and getting into these schools. I'm hearing elementary schools, we've got everybody who either has a vaccination, their first one, or as an appointment will get it soon. I shared at the board meeting, our middle schools and high schools are looking great also. We're trying to find those that haven't been able to get an appointment yet and get them in quickly. And our goal with that is, with Pfizer vaccination, it's 21 days for the second shot. With Moderna, it's 28 days. So if we can get the second one scheduled going into spring break, and then have those 14 days where then those teachers don't have to be quarantined, that's awesome. That helps us in the predictability. So if we can get all of our front-facing staff in this week, which we think that's going to happen during this weekend, that sets us up for great planning and follow through and a lot more purpose and predictability. So I just want you to know that I can't say enough to Nancy Ingalls, Amanda Thompson, and all of their teams and their work to get our providers working and sending out invites. And some of them are convenient. Sometimes people have to drive to Westminster, Lakewood, down to Colorado Springs, but our staff are doing that, and they want to get vaccinated, and they want to be back full in person and do different things. But it's a challenge. It's not going to be perfect. Even with vaccinations, we're going to have quarantines. Students, I get it. It's tough on that side, but it's I can't say enough of the positive, the hope, and what could come. So, Nate, sorry again, I was going to say jump in, but excited on the vaccinations and what that brings. So
it's all good. They'd rather hear from you than me. I'm just here to carry us between questions. So thank you, Mr. Wise, for those opening remarks. We are going to jump right into the questions. Our first category tonight are some questions that we've received around Hybrid 2.0. And our first question comes to us from Kathleen. I believe it's about our network. She asks, are the schools managing to keep the bandwidth and continual connection stable for all classrooms and all the video live streaming that is placed on the system with increased live stream classes daily?
Yeah, so I'm going to answer this, but Mark Blair, our CTO, is on also. But going into this year, our IT department purchased more bandwidth, and of our maximum amounts at the high school level on our highest output day, so of that 10,000, we used about 6,000. So the amount of excess is great. Middle school, I believe, has not even reached that 5,000 mark, so halfway part. So our bandwidth And the execution of extending that seems to be working. And it seems to not only be working, but we have a lot as it grows and the need. So I think that purposeful planning ahead, the implementation of it. Now, it's not to say there's not glitches. Remember, bandwidth doesn't mean that you don't have Wi-Fi problems, that there's not individual tech problems, that there's not Google problems or Zoom problems. As I ask kids, how's it going? I heard from students in Ponderosa that live out east, and some in Elizabeth, and some even past Elizabeth towards Kiowa. And they said, we don't have the same ability to get strong internet access. So, they've worked with our IT department to get the, I'm spacing the name, but
hotspots.
Yep, the hotspots. And it's helping, and they're not as glitchy and on those things. So I just want you to know we're doing everything we can to support families and kids are. I've heard the glitches that when you have parents working and kids at home and use up Wi-Fi, it slows down. It's not going to be perfect, but I'm really proud of what we've been able to do coming back with more synchronous, with a lot of the live streaming and using that and kids on their computers. We see kids with one-on-one. So I'm walking to classrooms, every student has a computer, it's up and it's working in different ways. So, and it's working. So Mark, anything you want to add to probably give a better answer?
No, Mr. Wise, I think you hit everything right on the nail. Thank you very much.
All right, thank you both. Question 2, I believe we are going to go to a live caller for this next question. I'm looking for a Leila Perkins. Leila, are you there with us?
I am. Can you hear me?
I can hear you. Thanks for being with us tonight.
Great. Thank you for having me. My question is, Hybrid 2.0 was supposed to be synchronous learning, even on remote days, but this isn't occurring. Instead, remote students log in to each class, attendance is taken, and they're told to log off and work on an assignment, which is completed in a few minutes, leaving the rest of the class period to do nothing. This is in core subjects and not related to times when remote learning is not conducive, such as a hands-on project. Why is this? It's extremely frustrating since the capability to provide instruction synchronously is available.
Yeah, so, that's a good question. I think as you come back, I'm going to tell you, first off, work back with the school. It's not going to be perfect. As I've said in all of it, we have schools that are further along and sometimes teachers. And everyone is working really hard to do the best they can. But readiness, and even though we have technology available, trying to create the structures to do that well, it's difficult. I'm going to tell you firsthand as in classes, when students make a choice the day of, how we make attendance well, who's supposed to be there and not, how we respond and get kids engaged and do that. When you're managing multiple spots, that's difficult. So when I say I'm proud of the work that's happened and the effort, it's not going to be perfect. So what I will say though, is I think in every one of our schools, reach out, talk, explain what's going on, and see if we can't help and make it better. I'm not going to say it's going to be perfect in each time, but make it better. But I'm also going to tell you, I see a number of classes where they're really working hard on what it looks like with synchronous. And synchronous and live probably shouldn't be every minute of every period, because that's a lot of time on the computer for everybody, right? So how we create quality learning and synchronous and live, it's going to look different in different contents, even core contents. But I'd encourage you to reach out and start with the teachers and principal and see what you can problem solve and find.
Great. Thank you, Mr. Wise. And thank you, Leila, for that question. We're going to pivot now to some questions regarding full-time in-person learning. And we've got another caller to help kick us off with that, I believe. Brian, are you online with us?
Yes, I am.
Hi, Brian. Thanks for being with us this evening.
Hey, thanks for having me. Hey, Mr. Wise, thank you so much for all the work you and your team did to get middle and high school back to some in-person learning. Sure appreciate it. I know you guys put a lot into that, and it's much appreciated. Question, what, if anything, and I would ask for specifics, please, would prevent middle and high school students from returning to full-time in-person learning following spring break?
Yeah. Oh, sorry, I didn't mean to interrupt
No,
you.
go ahead.
So let me go back. I think first off with the vaccinations, early on when we heard that teachers are going to be a part of the earlier phase of vaccinations, I was super excited. Then when that was changed, I was nervous about when would we be able to, because it's a two-part process. Now that we have vaccinations going again in all of our schools and we're tracking, we're asking teachers to tell us if you want one and haven't received the invite, let us know. Our providers are really trying to get them prioritized and in quicker. If there's leftover ones, we're trying to text them to get them their first vaccination now. So with the first one, allows us to set the appointment for the second one. The Pfizer vaccination with the first shot is about roughly, let's just say 50% protection, but the second shot is 21 days after. The Moderna one is about 70% effective protection, but it's 28 days after. So one of the things that we're trying to do is see when we get all of our front-facing staff their first one, and then set the timeline of when their second ones are. Currently, where I see it and we're tracking, I do believe we're going to have, I don't want to say all, because all or none is not fair to say, but I think we're going to have almost all of our student-facing staff, and that includes bus drivers, that ability to have their second vaccination going into spring break. That puts us in that time frame of after 14 days after your second one, you don't have to be quarantined. So that's big. So even if I have my vaccination, but then I'm exposed, I have to be quarantined. That's a part of that piece of, do we have enough substance, sustainability, and quality, which is an impact. But even if we're close in that time frame, that's going to allow us to make some predictability and some planning tentatively. So I say tentative when you say you want details. If the last board meeting today and principal meetings and working with staff, we're looking at returning after spring break. So we go off on spring break Friday the 12th. We're looking at tentatively saying after the 12th, we'll be coming back full in person at secondary. That would mean the 22nd in that return. That's the start of the fourth quarter. Things that impact that, quarantine still impacted. So we think, okay, we're going to be back normal. It's a new normal. We still will be wearing masks. Kids will still be quarantined. Those staff that don't have the 14 days will have to still be quarantined. So it's going to be more normal, but not perfect. So do remember, we partner with Tri-County. Tri-County reports back to CDPHE. We have to work in those processes to where it's going to be more normal, but there's still going to be issues. There's still going to be problems and bumps in the road. But you hear me in saying that's our plan. We want to build safety, but also on that side, the right timing. And I actually feel things are falling together pretty nicely. As I said earlier, I give kudos to Nancy Ingalls and Amanda Thompson within our HR and personalized learning and our health and wellness people and their teams, because they have been working with our providers. And we've been pushing to say, can we do a mass vaccination at Echo Park or some of our high schools? But the providers have put out thousands of invites for appointments. Our teachers are getting in, our staff are getting in, our bus drivers are getting in, and they're making it a priority. And I think as we continue on, it allows us to have data to make the right decisions and have more predictable decisions, because I know that's needed. You know, you want to have planning, you want to know. At the March 2nd board meeting, we'll have a more definitive outline. So you hear planning. I want you to know anytime they're planning, you try to reach that goal, there are variables that can impact it. The weather this past weekend, it impacted distribution lines to the healthcare providers for vaccines. The tickets to come out for this week have been fewer and are backed up. So weather could impact. There's other things that could impact that. So what could prevent that? Those are things that are already, creating a few challenges, but we're in a good spot. But those are things that still could impact it that we'll have to adapt to. But I think predictability right now, you hear where I think is quality planning, and I think is reasonable and sustainable. So that's what I'm not just hoping for, but that's what we're working and planning for. And our providers, we met with Kaiser on Sunday, and we said, all right, we have a tentative list of who hasn't. Can we get you this new list and get them new invites? So these providers are responding to intentionally target and invites our staff that haven't received one, so we can get them in, and that's only going to help. So I hope that answers your question. sometimes answer with a lot more detail, but you wanted specifics. If it's not enough, reach out to us. Send me an email or call me, and we can talk more. But hopefully, again, I could probably take the entire hour just on this question. But hopefully it gives you that time frame of how we're trying to use predictability of both sets of vaccines. I want you to know the other thing that we're hearing is after the second vaccine, there are times where people are feeling symptoms. So we're also planning for that. How do we cover? What do we do? What are our plans? If we have 15 people in a building that are going to get a vaccine on the same day, and the next day they have to be at work and they could have symptoms, we need to be ready for it. What does that look like if they have to be remote? What's it look like we have 15 people that have to be remote? So it's complicated. Let's hope for the best, but we're going to plan for everything.
Thank you for the question, Brian. We're actually going to pause for just a moment our stream. I'm understanding that closed captioning is not making its way into our Zoom channel here and our YouTube channel. This is going to require us to pause for maybe about 30 seconds. So that we can get that going. I want to make sure that the folks that are joining us that rely on closed captioning to engage are able to have those captioning. So we're going to go ahead and pause for just a minute here while Mr. Shalene gets our closed captioning up. Face. Mr. Shalene will give me the thumbs up when we are good to go. I just saw something happen over there on the left-hand side. So I think
we're set.
Working some magic. You are the man, Chris Shalene. Thank you so much. All right, so we're going to go ahead and continue now that we are back on YouTube with closed captioning. I do want to thank our captioning partners for making that happen, and Chris, of course, for scheduling all that for us for all these town halls and board meetings. Next up, we're gonna take a question. We're gonna go back to a live caller. I believe Sean is on the line with us, and I guess I didn't give good enough prep for Mr. Blair or Mr. Shalene, but we did sort of answer the last question. So we're going to move ahead to our caller here. Do we have Sean with us?
We do, but admittedly, I forgot the question that I asked, but I just sent Corey a direct question, which I'd love to ask him if it's possible.
Go for it.
You just brought up mass vaccinations for teachers and administrators, which I didn't know you were doing, and you're doing a lot of great stuff. And per my personal emails to you, thank you. But you gave me an idea. Can you influence the healthcare providers to start doing that for students and families after you have your teachers and administrators covered? Is that possible? Do you have some leverage there, or can you work with the governor to get some leverage there, or something like that?
Yeah. So Sean, you read my mind in a lot of things, but I'm learning so much about all of this. So when I talk about vaccinations, I'm giving you data of protection that I'm understanding. So I don't want to be exact because I'm not a medical provider. Pfizer and Moderna are the two vaccinations out, and the ages in which the youngest ages that can receive that vaccination are 16 and 18. And I can't remember which is which. But right now they are doing trials of the vaccinations with younger kids. And all reports that we're hearing is those might not be available for younger students, maybe even to next winter. I know they're trying to get that urgency, but they also have to go through the process to get that approved. And that's out of my control. And even, once it becomes available to just like I said with teachers, to try to get urgency to get people vaccinated, I will advocate for that all the time. But even now we're at an age limit. But we do have some of our high school students that have been vaccinated. Those that are some that work in nursing homes or with healthcare facilities. We actually have some students that have been vaccinated. That also gives them the protection of not being quarantined. The other thing that we've shared, but maybe not everyone knows. So say I test positive. The day I test positive, I have 90 days where I will not have to be quarantined after I come out of that initial COVID positive isolation, right? So we have a variability of not having to go through quarantine depending on that. But first thing that has to happen is it has to get approval for age groups to get that vaccination. And then, yes, I'm going to advocate, just like with everything, how do we help get that process? Because being in person is important. You can't replicate it. And the quarantines, I know quarantines are frustrating. I've worked through it with my own daughter, and and, you know, see with all of her friends and getting out in schools and listening and asking. I get the quarantine is tough. So we'll do everything we can to keep working the process and influencing how we can get better. And on the mass vaccinations, I want you to know, you know, it's been a huge help that Walgreens, King Soopers, Safeway pharmacies have opened it up. And not only in our own invites, but teachers have been setting up appointments at the pharmacies now, and that's been huge. So the number of providers we have giving the vaccinations, again, as I'm getting into schools, 1 or 3 people left that need their first one, and it's not mandatory. I'm okay if people choose not to, but they know that they're comfortable being in person. That's our choice to have that. But access and availability that we have right now to almost all, and we're getting the rest of them for sure, their invites. That's what I care about most. I don't want to miss anyone that wants it. I want them to have that opportunity, and what that's going to provide for us to not only just not be in person, but do it better and do it well is important. Okay. So I appreciate that question, Sean.
Yeah, thank you, Sean, for calling in and being with us today. I'm so sorry. Apparently, my dogs are not a fan of our town hall, so I'm going to try and get my stuff together before we host the next one next month. We are going to move along, though. We've got another question here from Chan, who says, why is it that schools like Valor have been able to be full-time in person since August, but Douglas County is still figuring things out? He said they have mastered safety, social distancing, and learning without the outbreaks that we are concerned about here in DougCo.
Yeah, so I'm gonna push back a little bit. Valor is one school. Valor as a school is smaller than almost all of our high schools. If we have one school, and let's pick out any of our high schools, some of them have been impacted greatly by quarantines and positivity. Others, hardly at all. So I think on that case, if you're one school, your ability, they have gone out on quarantines. They do have. Then they're trying to build synchronous, but they aren't perfect in their work. They have had quarantines. I'm also going to say this. I don't think they're necessarily breaking rules, but they work with their level of what are they willing to compromise and who's all checking on what their quarantine processes are in contact tracing. Let's face it, we're a large district. At times, whereas if we aren't doing those rules, we typically get called out. Look how many times we're in the news. So on that end, in a large district, and you look at where we're at, there's a lot of variables, but it's not perfect at Valor. It's not perfect anywhere. I am friends with a lot of these leaders, whether it be charter schools, private schools. They are experiencing similar things. But when you're that small, you have the ability to adjust just for your school. You don't need as many subs. If you have people and your requirements for your substitutes that you can work on. That's why I reached out to parents to be more subs, and people have responded. But we are a huge system. And in that huge system, you need more resources. So the ability to sustain with number of substitute teachers covering with amount of quarantines. And then on the health side, you know, we try to work our processes, but in a large system, and that many people, it's different. So it's like comparing apples to oranges. And I will tell you though, I've gone out and visited schools. I've walked to see what they're doing. I just had a conversation this week with the school in Utah and talked to a teacher. And I've been told, yeah, Utah has been back earlier. Different state, different requirements. But you're right, some of those schools are back earlier. Not all their teachers were vaccinated. But there's pros and cons to that. Some of their teachers are teaching remotely and they have an aide sitting in the class and covering. They've had quarantines, they're going through it. Each state is a little bit different, and each school and district is a little bit different. The great part about being large is we can offer comprehensive courses and programming that not everyone can. The hard part about being so large is the ability to shift that quickly and look at the number of resources needed just to cover. It's very different. So that's just reality. But I'm also going to tell you, they aren't perfect. They're doing a lot of things well, but we are doing a lot of things well also. But each school is impacted a little bit differently. And just like last fall, we had some schools that got that quarantined very quickly, and some schools that quarantined several times, others that weren't as much. And that's true at every level, including elementary being back right now full time. We have some elementaries that don't have many cases. but it could hit them next week. And we know, just like any virus, then it multiplies as ripple effect. So let's hope and plan that the mitigating factors, that we don't have it. But, you know, with more people, you see that impact.
Thank you, Mr. Wise. Our last question here, I think for this category comes from Jen. She's asking if Gen Ed students are receiving 5 days a week of learning, why isn't that available to ISS students?
So ISS students, there's a spectrum of need. Our most impacted students have been back in person 4 days a week. We look at our hybrid model and students are here 2 days a week for sure. We do have interventions depending on needs. So there are some students who have more interventions built in. So I think it's dependent on an individual and what their needs are. I encourage you to reach out to the school, but we are also now building back for what it can look like for full-time in person. And we see that availability of vaccines to be able to do that. But even then, it's not, I'm going to tell you, we will have quarantines. When you have 30 kids in a class, think about it right now in a hybrid. If a person is sitting in a spot and they're positive, you do that 6 foot radius. When you have social distancing, fewer people are quarantined. When you're back normal and you have 30 in a class and you have a positive, that 6 foot radius, you have a lot more people who are quarantined. So then when you put it over 7 classes, because that individual will go through a day and will be in all 7 classes, you multiply that number by 7, and that's where you start to see that impact. And sometimes in a school, you have more than one person that's positive or exposed, and they have a family member that didn't realize, and then all of a sudden we have to go through that contact tracing. It's a domino effect, and the number of days back, we're building forward on that. There's going to be more as we get going forward, but you know, each situation is different. But our most impacted students have been 4 days, and trying to target and build in success. You know, work back with your team. Call the school. I'm not going to promise that it'll be more, but we want to promise that we'll look at needs and responsiveness and try to build success the best way we can.
All right. Thank you, everyone, for the questions in that category. It looks like we were supposed to have a caller for this next question, but it looks like they may not be online with us here, unfortunately. I do have a copy of the question, though, that this individual is going to ask, so I will ask it on Gary's behalf. He is asking where the 40-minute rule comes from. He has not seen references to this guideline on CDC, NIH, or other reputable sites. He says, further, why can't older students avoid quarantine if they follow the same mask/eye protection protocols as teachers?
So Lisa Cantor is much better at explaining this than I am. So I'm gonna pass this one over to Lisa if you're available to jump on, and if I need to, Lisa, I can partner at the end, but I think you'll do a much better job explaining this detail.
Sure. Thanks for having me. And I'll try my best, Corey, to explain it. The 40-minute rule comes from the cases and outbreaks guidance, which we are required to follow by public health order. At the end of that are the flow charts that we follow to help us make decisions about who is a close contact, who can return to school and when, and other information there. So I'm just going to hold up this document right here. And this is how we identify students who are able to be target contact identified or enhanced contact identified. And it really has to do with criteria in that middle blue box of that document. If all of those criteria are met in that middle blue box, then we can target contact trace. And that really has to do with seating charts and not engaging in high-risk activities like singing or vigorous exertion like PE class. So when we can't target contact identify students, then we go to the enhanced side of that. And there's 3 criteria that identify people as a close contact. Just being in a room for 40 minutes is one of those criteria that would identify all of those people in an entire room as close contacts. Or if a person was within 6 feet of a sick individual for 15 minutes when both parties are masked, or within 12 feet of an individual, like perhaps in gym class or our SSN rooms, if they're within 12 feet of somebody who is positive or symptomatic for 15 minutes. So if you meet any of those criteria, you're considered a close contact. The 40 minutes really is about an entire class period of people who can't adhere to seating charts or engage in that vigorous activity. That's where that comes from. Where the exemption comes from is for teachers only. And you ask about the face shields and the KN95 or surgical masks that are worn to provide an added layer of protection to those folks. Teachers are the only ones that can apply to. And the rationale behind that is that they are the ones that can consistently apply that and retrospectively can look back 3 or 4 days prior to that positive exposure to say, yes, as an adult, I consistently applied those mitigation strategies and I remained, can attest to remaining that distance to be exempt from that quarantine. The CDPHE feels that kids, not so much. Can be relied upon to recall their ability to do that. Therefore, this criteria only applies to teachers, and that is in the spirit of preserving as many teachers as possible to allow them to continue to teach in the system. So that, in a nutshell, sort of explains why we utilize that criteria. If you're interested in more data on that, there is an asterisk on that flow sheet with a great article from the Lancet that talks about some international data regarding those mitigation strategies and how effective they are. Also very interesting.
All right, thanks, Ms. Cantor. I appreciate you sharing some time with us this evening. You've been with us for our staff and our town halls, I think, since the get-go. So we appreciate you always giving us some time. We're going to move on to our next question now. This one is kind of a hodgepodge. I created the question off of a couple of different questions that were essentially asking the same thing. Folks in our community want to know where they can find up-to-date information on quarantines throughout our school district, and they would like to know the number of student quarantines and the number of staff quarantines. And I think on top of that, additionally, folks would like to also know if there are plans to change our quarantining procedures to facilitate return to full-time in-person learning. So I know that is a beast of a question. I tried my best.
So, in fact, in our principal meetings today, we talked about this on a number of levels. We've not only started to track the quarantines at each school, but we've actually updated our district website and our COVID-19 tracker, our dashboard. So if you ever want to find your individual school, you can start to look there. We wanted to make that more known. The other thing that we've heard from schools and parents is the amount of emails we're sending out. It's overwhelming, right? So we've tried to look at, do we want to change that process of that communication so that way we're not telling you every single detail, but then you can go to our dashboard to see the quarantines in individual schools. So we're working on that. We actually have a COVID team that meets every Friday. We're looking at how do we do better with contact tracing? How do we do better with our data record keeping? How do we do better with our letters and messaging out? So we're taking that feedback back tomorrow, and we'll be moving forward with some ideas to improve it. Just like with everything, we create processes and then start to take feedback and see how we can improve. So I want you to know, go to our website, hit that dashboard. You'll start to see that for individual schools. You might and probably see some updates to even our letters, and that will become possibly formalized tomorrow, then with changes possibly in the next week. And I say possible because anytime you get feedback, you listen, but you have to take it back to say, okay, what are we missing? Who else could it impact? And I don't want to guarantee that's going to happen, but I do hear that there's some great conversation today with principals. Lisa Cantor was part of that in our cabinet and saying, that's a good idea. Let's take this back and see if this is a good improvement. So hopefully that answers Lisa. The last part of that. Tri-County, along with who they report to, CDPHE, they're always looking at how do we evolve within our quarantine process, but they also have to work under their guidelines. So yes, we try to influence. Yes, we try to share examples and do that. But we will always try to improve and up things, get better. But we also have to listen and understand why decisions are made, and then we work on how can we do this well. So our control of that is working, influencing others and giving examples, but also respecting that they're the experts and they hold everyone accountable on that side. Some are guidance, but you do want to follow best practice. Some are requirements, and we try to do a good job with everything. So Lisa, I don't know if I missed anything on that or if you want to add, but hopefully I've covered it well.
Yes, I think you did. Nothing to add.
Okay, great. So like Mr. Wise did say, please do visit the Road to Return page on our website, dcsdk12.org. Click on the dashboard link. Tons of data that gets pulled by our awesome system and performance folks. So and our IT folks. So please do check that out on our website. We're going to pivot. We've got some questions that are sort of miscellaneous questions that didn't fit into our other categories, and one big hot button issue that we wanted to make sure we addressed tonight was around transportation. So this question came to us from Michelle. She asks, when will regular full bus service return to normal? We are still experiencing one stop only for pickup and drop off, which creates challenges for working parents to have to be late to work or leave work early to get to the stop. She says the current stop is too far to walk, especially in the winter.
Yeah, so great question. I want you to know Rich Cosgrove, our Chief Operating Officer, is going to jump in and take this over. But the amount of work he and his transportation team put in, we had $31 million in cuts last year. We had to cut some of our transportation, but their work to be responsive, their work with Tri-County, they're opening up seats, they're working with who's riding and adjusting routes is ongoing. But in all reality, we do have a shortage of bus drivers, and you can't do everything perfectly. And there are going to be times where there's some distance involved, and you try to create reasonable amounts. But also I'll say, yeah, there is cold weather. There's times where it's tougher to do, but I want you to know, I can't say enough about the work Rich and all the bus drivers and teams try to put in. And Rich, I'll turn it over to you.
Thank you very much. Michelle, thank you for the very good question. Because of ongoing discussions with health authorities, as of February 8th, the buses are now able to be fully loaded, which enabled us to begin offering transportation to more students. Bus routes are now able to transport more students and those who live closer to their schools. Routes are now designed to provide transportation for all eligible students who attend their home school of attendance and who live more than 1.5 miles from the elementary school and 3 miles from their middle school. Now, this is slightly further from schools than the previous 1 and 2 miles in previous years, but as Mr. Wise said, that's due to a continued shortage of drivers and transportation educational assistants. And to put it in perspective, since 2018, we have reduced from approximately 300 to 200 bus drivers. So that's a significant impact that we've been challenged and continue to attempt to overcome. Parents of eligible students have also been invited to sign up for Smart Tag. And transportation, we are continuing to analyze ridership, and we'll make adjustments as needed and invite additional students to sign up as possible. I do want to note that our transportation routes are designed for full in-person, which we are already at elementary. Of course, with hybrid at middle and high, only the A or B cohorts are riding those buses at any given time. We did that in anticipation of quickly pivoting to full in-person, instead of designing routes to be fully loaded at hybrid, because then when we go to full in-person, we would have to cut stops and reduce ridership, and we don't want to do that. So I hope that answers your question.
Thank you, Mr. Cosgrove. We appreciate the work that the operations department is doing, and obviously our folks in transportation. Not an easy job, but they've toughed it out this year and have made a lot possible. So thank you to you and your team. We are going to move on to a question that revolves around the grading standards, and I think this is in reference to the grading system that was in place to end the semester last semester. It comes from Mamuna, and she asks, with the unprecedented schedule towards the end of the school year, do you believe it will be beneficial to implement the same grading curve that was established towards the end of last year?
Yeah, I appreciate that question. We responded to a need that was brought up by high school principals last year, or last semester. I would say that we've been building to say, how do we do it better for this year? I don't plan to adjust that. And principals know, and I've shared with student town hall, we want to work proactively ahead of time. All of our teachers are doing their best to do that. Schools are working on it. But when we look at a system last semester and responsiveness, this semester, I see differences in the remotes and identifying students who are struggling earlier. I see, and have been in schools to see the differences in hybrid. It's not perfect. And yes, there are kids struggling and it's tough. But I would say what I would ask of you, with you and your students, when you start to see a bit of struggle, reach out to the school, build people in. I've asked the schools to say, when you see a bit of the struggle, reach out to the students and parents and build people in. We need to be proactive. We need to work together. It's better to do it with each teacher. Set a plan. We want to get to learning. We did do some of that last year, but we felt systemically there are things that were out of our control with number of quarantines and impact that did we do that well across the board? And that's why that happened. But I will say to be proactive and learn. The expectation's a little bit different. We're going to work through each situation, but that's where I've landed and working forward with our schools, with our principals and with our teachers. But that's also grading's a partnership. The ownership is of students and parents to do it differently and learn from it, be better, and to reach out earlier. We need that too. So hope that helps. I've got a daughter who's a junior, and it's, I get it, but it's also how we help her advocate. And when she starts feeling overwhelmed, set a meeting, set a time. And we've tried to build in more accessibility to teachers to ask questions, and schools have built more interventions, sometimes on Fridays and other times to try to do that forward, but it's not going to be perfect. But reach out. We're going to try to all work together to find solutions.
Great. I think we've got time for about 2 more questions here. So we're going to jump into this one from Michelle, popular name for folks to submit questions, apparently. She asks, what do you predict sports and activities such as marching band will look like in the fall of 2021?
All right. So I'm going to pass this on to our Director of Athletics and Activities, Mr. Derek Cheney. Thanks, Derek, for jumping on and taking this. And I can always help at the end.
Yeah, no problem. Thanks for having me, Corey. Hey, we're going to try to do everything we can in the fall. We're very hopeful that both sports and activities will be as close as back to normal as possible in the fall. Things are constantly changing. We don't know where we're going to be in the pandemic with COVID in the fall. But know this, we will do everything we can to offer all our activities and athletics in the fall, including marching band. We know the value of activities and athletics and the importance it plays in our students' lives and their education. So we'll do everything we can. The good news in the fall, including marching band, most of our activities and athletics take place outdoors, which is a big deal to be outdoors versus indoors, because there's a lot less restrictions outdoors than there are indoors. So can't guarantee anything, but we're certainly going to try the best we can to, once we hit the fall, that we can have everything as close back to normal as it can. Of course, we have to work with CHASA, our state organization, and the variances they get through CDPHE, but we'll do the best we can. And again, most of them are outside, so that's a good thing.
Great. Thank you, Mr. Cheney. Again, thanks for hopping on one of these. I know that it's not always easy to give up your time, but we appreciate it every time. Last question is, we're going to kick this one, I think, over to Mr. Reynolds. This is a question regarding state testing. This respondent wants to know, how will standardized testing in April be accomplished while adhering to social distancing?
Great question. Good evening. Thank you for having me tonight. This is a very popular question at the moment. Right now, our stance is very similar to most districts in the state, in that we plan on administering these state assessments in concordance with the schedule as determined by the Colorado Department of Education. That being said, we're going to continue to monitor both state and federal legislation as it relates to state testing. That can certainly change. I do know that there may be a possibility for another pause, as it were, from last spring, either by our governor, State Board of Education, Colorado Department of Education, or legislatively, and we'll continue to monitor that. In terms of the actual administration and proctoring of those tests, we will continue to follow the health guidelines as established by Tri-County Health and CDPHE. We've already administered several tests in our schools, including SAT and PSAT, and we've been able to manage those social distancing requirements, along with other safety mitigation strategies like masks and hand washing, and administer those tests. And so we'll continue to follow whatever guidelines that we need to for safety mitigation strategies.
Great. Thank you, Mr. Reynolds. I appreciate the work that you and your team are doing to help support our data needs and testing. I think that's actually, Mr. Wise, going to bring us to the end of our time this evening. So if you had any closing thoughts, I thought I'd give you the floor one more time to close us out.
Yeah. So first off, Nate, thanks for all your work to MC this, and Chris and communications to get these things set up. Thanks to all the parents for sending in questions, being a part of it tonight, and ongoing. You know, in these times, the ability to be flexible, to be understanding, the ability to take the time to reach out. You know, you heard me say partner up with your students, partner up with your schools. We're not always going to give the exact answer you want to hear. Sometimes we will, but how we work together to work through the bumps in the road, I want you to know the efforts to do the very best we can in each of our situations, and really trying to get teachers vaccinated so we have more predictability, and stronger planning is key. But all of this is planning. And, you know, as we have that, there's no perfect time to come back, whether it be before spring break, right after spring break, or later. There's no perfect time, and predictability, just like we saw when we had elementaries come back right after Christmas break. Predictability of what's going to happen, we can't have. With the vaccinations, we're getting more predictability of what we can control with our staff. And that's important. So we're looking at all that data. We're looking at when these things happen and what's the best time and the right times to come back. But even when you start to pick the best times, guess what? Whether it be earlier, later, you never know what's going to be exact. That's the new world we're living in right now. We want to build normal, but it's a different normal. Even when we have teachers and staff vaccinated, they need to wear masks. Students that have been vaccinated still wear masks. That's what is being recommended to us. And those good habits and modeling and protection, you know, there are some cases that we're hearing that after you get a vaccination, you could still be positive with COVID. So we're learning as we go, as are all of the medical agencies. So in this, it's evolving, it's changing. There's not exactness. And I don't even know if that's a word, but it sounds good. I want you to know that we all have similar intents. We all are working hard together. I will tell you, being in the schools, the efforts, I can't say enough. I truly, if I can say one thing, I want to say thank you to you, and also to your kids. As I'm talking with kids in the classroom, say thanks for being here. Thanks for all your work. Thanks for the work you're doing to make a tough year better. But I also want to say thank you to our schools. And, you know, I was at Summit View the other day, and as I'm walking in, a parent got out of their car and came up to me and said, thank you. It meant the world. It doesn't need to happen. I get it. But take a little time to recognize the positive, to recognize the effort, to show appreciation to it. Can't hurt. It can only help at times. But also in those challenging times, we want to listen. We want to try to help. We can't fix everything. But I want you to know all the people are willing to listen, are doing their best and trying to help. And sometimes when we give an answer, we try to help you understand. And you don't always have to agree, but we try to build understanding. And that clarity of message and those systems, there's a lot more planning and work that happens than maybe you can see and realize. I try to tell the story and paint the picture, but it's hard to get that out to everybody. But if you need, you know, we have great people who will be willing to listen and willing to give information, myself included. So thank you. Thanks for being a part of it. You know, we'll have more of these in the future, and want you to continue to partner up and build that in. So appreciate all of your time and being a part of this. And Nate, again, thanks to you and Chris and Stacy and the whole team, and to all cabinet and Lisa Cantor. Thank you for being on this meeting and answering questions with this, because it's important to get as many questions as we can and try to build understanding. So I appreciate all of you.
Thank you, Mr. Wise. And again, thank you to everyone that attended our town hall tonight. Please check our website for up-to-date information. Also, questions that were answered here, as well as other questions we didn't get to. Look for the answers to those to our frequently updated, frequently asked questions page on our website. Yeah, thanks for joining us. We appreciate your time. Good night, everyone.
Thanks, guys. I could give it a few minutes for YouTube to catch up before I stop streaming.